The U.S. healthcare system and employment opportunities are constantly evolving from the influence of macrotrends. And macrotrends are directional shifts that allow us to analyze projected occupational opportunities as well as projected occupational shortages. Today, we're going to be talking about the macrotrends affecting the healthcare system in the Washington, D.C. area. We pinpointed 3 of the largest driving macrotrends affecting the current health system of the area. Analyzing the demographics, policy, and technological advances of the area has allowed us to explore provision of care, the development and implementation of policy, and technical engineering and management. These macro trends, along with the current COVID-19 pandemic, are shaping the future of the healthcare system and employment opportunities in Washington, D.C. The demographics of Washington, D.C. are extremely unique, as it serves as a home to over 749,000 residents, which is expected to increase by more than 20,000 residents by the end of the year. The area is expanding at such a rapid rate. However, the expansion of care has not been evolving at the same rate. There's about 114 primary care physicians per 100,000 residents. Similar shortages exist for dentists, mental health providers, and long-term care facilities and nurses and other providers. DC is especially unique when it comes to provider shortages, as it has begun the process to defund its last public hospital by January 2023. As the total population increases of the city, the aging population increases as well. Residents ages 60 and older make up 16.5% of DC's population. In addition to shortages in primary care providers, the increasing aging population will provide opportunities in assistive care services, such as home health aides, and the expansion of long-term care facilities, workers, and administrators. DC's demographics are constantly and rapidly changing, especially its rate of residents in poverty. The city had a poverty rate of 16.2%, which was way higher than the national average of 11.8%. Unfortunately, the rate has only gone up since the economic crash imposed by the current COVID-19 pandemic. Although the poverty rate is high, only 3.5% of the population did not have insurance, which is due to the Affordable Care Act of 2010. To support this impoverished population, the city will need to expand its community health network, providing occupational opportunities such as community health workers, community health educators, and community health administrators to not only improve access to care, but to lower the cost of care for its residents. As the demographics of the city are changing, the policy is also changing. So Adia will give us more information on that.
Thank you so much, Sloane. I appreciate everything you shared with us just now. With respect to healthcare policy explores ways in which opportunities can be provided for healthcare equality to all community members. Healthcare policy tracks a framework for nutrition, disease surveillance, and the top causes of death by disease that are the most prevalent in society. In Washington, D.C., the top 5 causes of death are heart disease, cancer, stroke, diabetes, and chronic lower respiratory disease. Other notable related trends in D.C. are under surveillance for the prevalence of the human papillomavirus, high percentage of opioid prescriptions issued, and overdoses from opioid addiction. There are several factors that have shaped healthcare policy. The first is the HIAP, Healthcare in All Policy, helps community members who have challenges with social economic circumstances. The HIAP provides preventative care treatment options with a specific focus on demographics most affected by healthcare inequality. The CDC has a joint merger called the National Prevention Strategy alongside Healthy 2020. These two platforms mainly are facilitated through the local and state government level. The Healthy 2020 healthcare workers meet community members at health fairs, gyms, local community centers, recreation centers, and parks. Information is shared how small, healthy lifestyle changes could add years to their life, such as proper diet, exercise, and maintaining routine doctor's appointments. Some of the information given to community members target ways to improve the odds of obesity, type 2 diabetes, and chronic pulmonary disease. The Affordable Care Act is the second most important component in healthcare policy. The Affordable Care Act, the ACA, will continue to shape the future of healthcare in the United States. The Affordable Care Act has become known as the healthcare exchange market. The Affordable Care Act was designed so that everyone could have an opportunity to receive healthcare insurance, whether you work for yourself, have a pre-existing condition, or cannot afford your job's healthcare insurance plan. However, the concerns for the ACA are how affordable the healthcare plans are distributed. Those that are considered high income earners are expected to contribute substantially more to their healthcare insurance plan, while those that make the least only have to contribute the bare minimum. Those considered below the income line are locked in at a certain rate, while higher earners can see their premiums continue to soar. Policy to make changes to the Affordable Care Act are being considered to make everyone pay a little more so that the cost of healthcare is shared through the healthcare exchange market. Another avenue being considered by Congress is to allow children and young adults who need long-term care to be able to go on Medicare to lessen the government's expenditures and contributions to the Affordable Care Act, specifically as it pertains to pre-existing conditions. Surveillance and healthcare policy is the final component that's very pertinent to healthcare. Health information technology is at the center of health policy surveillance in the current state of healthcare and in the future. A couple of trends in finding more ways of collecting data for area surveillance are lab reporting, digitally data sharing with multiple practitioners within the healthcare spectrum all at once. This will allow for greater clarity and a wider range of information provided to the healthcare team for solutions. COVID-19 is an area in which healthcare policy has an innate need for more surveillance, especially in the DC region. DC has more than 11,700 confirmed cases. Neighboring states, Maryland and Virginia, have both more than 83,000 cases confirmed in each state. There are three top priorities in providing the community with COVID-19 surveillance: early detection, spread determination alongside medical information, and public health information sharing. That concludes the important components that we have to healthcare policy. Now I'm going to turn the next series of information over to Mary.
Thank you, Adia, and thank you, Sloane. Great information. I'm going to talk about digital technology and how that macro trend impacts the Washington, D.C. area and the future of healthcare. Digital technology is able to help address major clinical problems and diseases due to proliferation of the development and also new discoveries. The Internet of Things, for example, devices and wearables, in conjunction with the better communications, 5G, LTE, allows the connected medical devices in healthcare to generate big data and to provide more information so that you have a better ability to provide care. The applications include medical devices for inpatient care, wearables for remote patient monitoring, and surgical robotics. And those are just a few of the things that really do impact in terms of the Internet of Things types of opportunities. The IoT devices exceed 30 billion units in 2020 and upwards of 75 billion units by 2024, with a market forecast of 500 $34 billion by 2025, with an annual growth rate of almost 20%. It's pretty impressive. The ACA, and also then you have the ACA, which Adia discussed, mandates electronic health records. And using the electronic health record standardizes the input of data, and also with that, it generates big data. It generates a tremendous amount of data, everything from clinical data to personal data to disease profiles, all that stuff. And because of that, the data is either structured, unstructured, or complex. And that is defined as big data. And big data also means that you cannot use traditional methods and older styles of managing that data and analyzing that data. Even storage of that data is a big issue right now. So using the big data analytics, and then in addition to with AI, you can analyze vast amounts of data, you can reduce errors, automate clinical and administrative processes, do image analyses, and support clinical diagnoses. Right now, the bigger issue with big data and AI is really with respect to cybersecurity, and so more research needs to be done with that, and how can you eliminate data breaches in the future. There are 10 applications that currently create up to $150 billion in annual savings for the U.S. healthcare by 2026, including robot-assisted surgery, virtual nursing assistance, administrative workflow and fraud detection, dosage error reduction, connected machines, back to our medical devices, clinical trial participation, preliminary diagnosis, and cybersecurity. All of that information then leads us to blockchain technology. How can you utilize that and combine those things together? Blockchain technology has been, I'm sure you're familiar with it from a Bitcoin, or you hearing about it more in the sense of financial. However, what is great about it, it's a growing field, needs work. You can use it to maintain security of the data while enabling delivery of the data to different organizations with varying criteria. And that allows either people to own their data or give limited rights to data. There's a lot of legal, ethical implications attached to all of these things in digital technology. The biggest issues that are going to come up will be data collection, policies associated with that, privacy issues, your ethics, who uses the data, who owns the data, and how do you use that data? How can that data be protected? But also, we don't want to use it for targeting or for profiling. Also, there's going to be legal impediments and lack of appropriately skilled specialists. That last one is pretty interesting, because if you don't have the technology, you don't have the people to support the technology or do the research, you then have shortages. And that's what I like to call opportunities, because an opportunity includes shortages. And really, you need to have those additional skills and advanced skills. So there's always a growing market for that. And interestingly enough, that segues and leads me to my next topic, which is the occupational opportunities related to demographics, policy, and technology. In the Washington, D.C. area, we are an extremely unique market. We are not like any other market in the U.S. We have clinical needs and requirements, but we also have federal government, which is the driver of policy. What also means then, from an occupational standpoint, that means, especially with the changing demographics, you have a need for clinical care, but you also have a need for the support for policy, the technology drivers, and all those things integrated. The diverse demographics and economic ecosystem here really provide lots of opportunities in terms of, well, let's start first with personal care, your clinical care, and your human factor expected. There's a lot of, we need more nurses, we need more doctors, we need more, and there's shortages. I mean, it's well documented in terms of that. Also, alternative care models where you use nurse practitioners or other types of primary caregivers, such as CVS or the urgent care clinic at Walmart. I mean, those are other opportunities and places where they're going to need employees. The Bureau of Labor Statistics projects a 14% increase in all healthcare occupations. The bigger 48% of growth anticipated is for public health practitioners, home health and personal care aides and providers. Home health aides are people who work in the home under supervision, clinical supervision, and allow people to stay in the home. The personal care aides also are important in terms of providing care to those people and coordinating with the home health aides and the traveling nurses, et cetera. It allows people to stay at home, and it also allows the provision of care at a reduced cost. With respect to our policy issue, we have different types of policy needs. We need public health policy analysts. We need people who can understand and help develop policy. The people who are analysts will help develop, they'll help, the market is such that they can help also the insurance companies. So there's a broad range of places where you can do that. The other thing, in addition to that, you need healthcare, you need health services researchers, and those are the people that can help also. One of the things to remember is you have that consulting aspect, but you also have it from a homegrown, a societal aspect. Healthcare policy analysts can help the government, local government, take society requirements and hopefully try and target the needs and what needs to happen from a term of provision of care and areas that need more help and more support. So the last area of opportunities is for technology opportunities. And really the three positions I'm going to talk about are biomedical engineers and robotic engineers and health informaticists. I'm going to start with health informaticists. Health informaticists are the people who are at the intersection of the systems and the functional providers. They are the ones who help translate the requirements from a functional provider to the systems development, systems engineering, and that is so important because otherwise you get siloed communication. And that is an area that I work in, and I find that is very important. Health informatics is really an up and growing field. Engineers, biomedical and robotic engineers, you need to have that technology. As new technology needs to be developed, you need to have people who have those skill sets and that training to be able to do that. And that's an area that has some growth going. In some of these areas, and political climate really does dictate where we're going with things. Health policy, because of what's going on politically, you may not have a huge growth potential, but there is a potential that you need to replace people, and also you need to keep going with that. So those are the areas that we see as being extremely important within the DC area and the macro trends and employment opportunities. I'm going to turn it back over to Adia to wrap up our presentation.
Thank you, Mary. The information you shared was very informative. So for our conclusion, in healthcare policy, healthcare technology and demographics play a huge role in how the DC region is impacted by the availability of equality in healthcare. Government leadership through healthcare platforms and community engagements are changing the curve of healthcare disparity within local communities. The number one focus of the DC region when it comes to healthcare is preventative treatment options and area surveillance of diseases affecting the morbidity rate. Employment opportunities across all macro trends with demographic trends providing an array of health practitioners from in-home to highly skilled are going to be key components to forging a more inclusive healthcare delivery system. Policymakers will need more public health researchers and managers, just as Mary said, to ensure societal requirements are met within healthcare policy confines. Finally, digital technology will continue to require highly skilled engineers and scholars and visionaries to bring the promise of digital technology to fruition. Additionally, The prevalence of COVID-19 and the lessons learned from it will continue to impact healthcare for years to come. I want to thank Mary and Sloane for all your efforts and energy that you have put into our presentation.
As well as you. Thank you for all the information you provided for us.
Oh, you're
I
welcome.
agree. You guys have been a great team to work with. And if you have additional information, posted will also be our copy of our paper. We'll have references and a copy of our presentation. So thank you very much, ladies. It's been a pleasure working with you.
Thank you. It's been a pleasure working with you as well.